Hello and welcome to Rajya Sabha Television. You're watching our special show, India Fights Back, where we talk about the COVID-19 pandemic, the challenges which it has thrown at us and how we have been tackling those challenges here in India now. The focus of today's show will be India's global role in this particular pandemic, how we have helped other nations. Effectively, if you look at the past few weeks, then more than 24 nations, specifically 25 countries, have received Made in India vaccine. Apart from that, we had earlier sent help in the form of medical supplies as well as other equipments as well to several countries there. Also, there was a workshop which was conducted about the good practices and the ways to deal with the pandemic and go ahead with the vaccination drive. So we're going to talk about all that and understand on a larger scale how exactly India is helping out not only its neighbors but other countries as well, and what does that imply. For more on this, we're joined by a distinguished panel of guests. Let me first introduce them to you, beginning with Dr. Samiran Panda, who is joining us, a member of the NEGVAC and head of the ECD division at ICMR. We're also joined by Professor Narendra Kumar Arora. He is the chairman of COVID-19 working group of NTAGI, and Aditi Tandon, special correspondent of the Tribune, is also joining us, keeps a tab on all these happenings, specifically on the pandemic aspect here. So let me begin with you, Dr. Samiran Panda. Let's start by, doing a sort of a roundup or a sum up of how things have been so far vis-a-vis India's global role in this particular pandemic.
All right. So this is something which is very important in terms of India's role in vaccination and how does it relate to the global needs or the global effort towards mitigating the effects of the pandemic. India, since beginning of the epidemic in the country, looked into several aspects. But in today's session, we are focusing on vaccine. So I will try to focus on 3 or 4 critical elements related to vaccine so far India is concerned. One is the product. So the product here we are talking about is the vaccine. And India, within 10 to 11 months of knowing the full genome sequence of the virus, got not just 1, but 2 vaccines developed within the country. So there, it was quite an achievement within such a short period of time. Previously, it would take 8 to 10 years just to develop a vaccine. The second bit is about the program. So, of course, I will, in order to memorize it easily, I would try to capture the themes in 3 or 4 Ps. So the second P is program. And in terms of program, the committees were formed and the planning started happening while the vaccine was not even in hand. So it was quite an extensive exercise, and all the district immunization officers and the state immunization officers, vaccinators, program planners, Ministry of Health and Family Welfare, they took it pretty seriously. And the preparation time was quite long and exhaustive. The third is about the provisions. What were the provisions that was looked into? And the new clinical drug trial rules 2019, dated 19th March, actually provided for using even phase 2 data to consider accelerated approval when the results were remarkable and safety was ensured through small animal studies, large animal studies, and even different phases of the human trials. The last bit, which is very important, and there I will try, see India's role in the context of global pandemic. So partnership in pandemic, India never took the vaccine nationalism route. It always said that, no, the whole world is my neighbor. And in July, when there was no vaccine available, there was this international symposium organized by the Indian Council of Medical Research, where India actually listened to the global views and also shared its views and achievements of the progress made in terms of the pandemic. So I would say that the product, program, provisions, and partnership in all four counts, India achieved marvelously, not only for Indians within India, but also for the whole global community. And that's something which really requires showcasing.
Okay, definitely. That clearly points out India's not only goal out there, which is to help everyone, but also the way we've tried to do it. And let me bring in Professor Arora here again as well. Professor Arora, from your point of view, it was already established fact that India is pharmacy of the world. But then in these particular times, that is the recovery from the pandemic, and that is where the vaccine comes in. We've been very generous. We've been very, forthcoming in helping other nations. And as Dr. Panda was pointing out, we've never adhered to vaccine nationalism.
I like the way Dr. Panda has enunciated this 4P activities. And I will just like to dilate those P's. One is that we were net importers of personal protective gears in the beginning. Today, we are producing almost 4.5 lakh PPEs and we are supplying to the rest of the world. We were not having a single kit manufactured here. We are sharing the we are producing, I think, how many? Almost 15,000 kits every day, and these are being shared with the rest of the world. 3, drugs. There were confusion. There are issues, but I just looked at the data. The production of hydroxychloroquine was increased by 7 times. Similarly, there was production of remdesivir and lipidavir. All these productions were increased several times so that we can help and share the material with the rest of the world. And now the vaccine, we have basic fundamental is Vasudevaya Kutumbam. We have considered the whole world as part of our family. And that is what is here. I find that even in the WHO and other international forums, suddenly the voice of an Indian or a representative from India is so much valued because our approach has been very positive and helpful. This health diplomacy has really helped us. Now, we should be very proud that vaccine manufactured in India, Covishield, will be the most voluminous vaccine which will be used throughout the low and middle income countries.
Okay.
And we are very soon hoping that the other vaccines will also be there. But even today, we have already, we have not used as many doses within India as we have donated out to our friends, almost 20 million doses. So this just shows our approach that we are not just self-centered, but we are looking after ourselves, but as well as we are looking after our friends, neighbors, and the other low and middle income countries who need us at this time.
Okay, definitely. It's all about caring for the global community, looking out for your neighbors and others as well in the world. That is something which is central to this particular, aspect of, going ahead and helping others by supplying vaccine. Let us also bring in, Aditi Tandon here.
Thanks for this opportunity. I was listening to Dr. Panda also. And you see, India's role in the global containment of the pandemic is huge simply because we are the second most populous country in the world. And as Prime Minister Modi said in the workshop of SAARC nations and Indian Ocean region yesterday, that the entire world was concerned about how the Asian region would respond because Asian region has, 2 very important countries, China and India. And through collaboration, these countries have come together and fought back the pandemic very well, so much so that the fatality rates of Asia are the lowest in the world right now. So the importance of collaboration cannot be overestimated, as the Prime Minister had mentioned yesterday. And you might also recall that at the start of the pandemic, India, at the initiative of Prime Minister Modi, was the first to actually invite any kind of regional cooperation to fight the pandemic. When on March 15, 2020, there was an important meeting of the SAARC countries, and the Prime Minister proposed the Emergency Relief Fund. And India was the first country to offer USD 10 million for this particular relief fund, after which a lot of countries also participated. Also, let's not forget that from the very beginning, India's response to the pandemic has been with a global worldview. We have, if you remember, in the initial days when we launched the Vande Bharat mission to evacuate a number of stranded passengers in Wuhan, the epicenter of the disease, India did not distinguish between nationalities. When we were extricating our own nationals, we never differentiated between other nationals, and our aircrafts were deployed immediately and readily to actually bring back foreign nationals of so many countries. We remember reporting that with a lot of pride in those days, and that was a time when a lot of countries were doing a lot of COVID nationalism, and they were only extricating and evacuating their own passengers, their own nationals from China. So right from the beginning, and you see, we were not self-sufficient when it came to testing kits. Dr. Samiran Panda is here, and ICMR's leadership at the time of the pandemic is incredible and will never be forgotten by the people of this country. How ICMR and its sister organizations responded to create testing capacities, not just to create testing capacities, to immediately culture the virus so that, we have genome sequences. Immediately work was started on the vaccine front. Personal protective equipment was being manufactured in India. Today, we are importing all that to our neighboring countries, to any country that is in need. You see, the whole concept of fighting a pandemic is that the world is a hyper-mixing vessel. And unless we act together, unless I think about your welfare, I will not be healthy, because that's the ultimate, that's the bottom line. This pandemic has taught us that we are in this together. Either we are in this together or we are all doomed. And the WHO has repeatedly warned countries not to practice vaccine nationalism. And in fact, the WHO Director General thanked Prime Minister Modi yesterday after India offered 2 lakh doses of COVID vaccine for the UN peacekeepers. So you see, these gestures go a long way in presenting India as a responsible, empathetic, sympathetic, and sensitive country at a time when so much of suffering, death, and destruction has been heaped across the world. And it is not just important for us culturally, because we are culturally rooted in these values. It is also important for India's diplomatic push worldwide that we are seen as a country which practices Vasudhaiva Kutumbakam, preaches it and practices it.
Okay, definitely. This is really integral to our values and culture, and something which we are practicing right now. Let me go back to Dr. Samiran Panda here. Dr. Panda, apart from, helping others in terms, starting off of the pandemic itself, as all of you have enunciated, and going to the vaccine, level as well. There is another development wherein the Prime Minister has recently spoke about how there is a need for a common strategy to tackle, the entire pandemic situation from here onwards. And that was done in a meeting of representatives of SAARC nations. Apart from that, of the 5-point agenda, which the Prime Minister seemingly was focusing on. So that is, it looks like, is the next phase when we are talking about not only giving relief, but also having a proper combined strategy.
Right. This is something which is, I would say, the modern day strategy, and it actually addresses the needs of the hour and the needs of the day today. Infections, be it virus, we are talking about SARS-CoV-2, the virus which causes COVID-19. That virus doesn't respect borders. Neither does it require a passport for going from one country to another. So it is all the more important, and it's better the quicker we understand this. And the regional cooperation and the call for regional cooperation becomes much more important from that perspective. that, as Aditi was saying, until and unless we join hands, none of us would be better off. So that's first of all very important. Of course, there has been an in-country anxiety expressed, although informally, that in the helm of affairs, when we are trying to have this regional partnership and global partnership, are we going to neglect the in-country cause? No way. So this whole call for working together also happened when the Honorable Prime Minister Narendra Modi, he talked with each of the chief ministers of the states, saying that why don't you know the epidemic of your state well and suggest me what I should do and chalk out your plan of action as specific and relevant and appropriate for your state. So you see, so this whole collaboration, the need for collaboration to joining hands is not only relevant or is not only something that he tried to encourage the regional leaders to sort of think upon or ponder upon, but also called upon the chief ministers to think through. But that also underlines that each state was differing in terms of the disease transmission dynamics, because India is a country, of course, but it's conglomeration of different states, and the disease transmission dynamics took different shape and courses in different states. So that gave rise to good practice examples where people who suffered from COVID-19 and successfully came out of the infection, they were a role model in terms of reducing the stigma and discrimination. And ICMR actually, created 4 different groups. The clinical groups, which were looking into the global evidence, but also generated the in-country evidence to figure out what works and what does not work in treatment. The second group was epidemiology and surveillance working group, and that looked into the national level serological survey. And we now know what important role it played, because the last or the third round of the national serological survey clearly underlined that majority of the Indians are still vulnerable because they are not infected. So we cannot let the prevention guards go down. The third working group was the operational research working group, where you will recognize that Dr. Arora is also an active part of. And the fourth one was about looking into the development of the advisories, be it treatment related or be it in terms of the advisories and the laboratory testing related issues. So all these 4 groups really helped country to not only look into the in-country evidence that was generated, but also global evidence to be able to fight out the epidemic.
Okay. Let's also hear Dr. Arora here on this aspect, of the combined strategy, which, as Dr. Panda was pointing out, that it is not only that India is advocating it with the other nations and to other countries, but also nationally, internally, when we were trying to tackle the pandemic in the initial stages. That was the strategy which was deployed.
That's true, absolutely. So in fact, right from the beginning, what I think all of us are saying, that a very comprehensive strategy was formed. There was total uncertainties, as the Prime Minister very rightly said. There were a lot of unknowns we didn't know. And it was like the biggest public health experiment going on, because it was bold from the blue. But because there was consultation, there was joint decision making. One of the examples I would say that there are a lot of naysayers about the lockout which happened initial 6 weeks. And there are now modeling exercises available which say that if lockout was not done, we would have lost 2 million lives. While today we are just around 0.15 to 1.2 million. So these decisions came because of the joint decision-making processes. The second important component, I think, which we have taken up simultaneously and for which preparation started in July, that as and when vaccine comes, how it will be rolled out. Such a structured vaccine rollout, now the world over, everybody is asking, how are you managing? How will you manage 130 crore people in this? And how are you going to immunize 30 crores in next 5 months or so? And the innovation was COVID. We used a supply management software built on that beneficiary management system. And now there is a possibility that India will be able to share this with a lot of our friendly countries to help them to roll out the adult vaccination, which is not an easy task. It's a much easier, difficult one, and people would benefit all over the world on this. Then the third component which has come up is that real-time monitoring of adverse events. This is again something like a dream come true. At the end of the day, I know how many people have got first dose, how many people have got second dose, and how many people have developed any adverse events, mild, moderate, or severe. So this kind of a comprehensive approach, which is not only valuable for us, but for the whole globe as an example, are great. One feels very proud and nice about it.
Okay, indeed. Let's hear concluding comments from Aditi here as well. Aditi, as you saw it happening, you were explaining earlier, and then the way we are moving forward in terms of that combined strategy part and the empathy which India has shown, the global leadership, the global role which we are playing in this difficult time.
No, absolutely. I agree with both the experts on the panel totally and absolutely that India has developed a number of digital and technology-driven solutions which are going to help not just the neighborhood, but the entire world. A very important aspect of the global partnership going forward would now be with respect to preparations for any future pandemic. You know, if you look at important research works that have been done on the history of pandemic influenza, a very important work has been done by Michael Osterholm, who's a US-based tropical medicine specialist and epidemiologist, who has actually said that, you know, you do need global collaboration to invest money on a 21st century game-changing vaccine which will work against all influenza strains. And experts have time and again warned that pandemic influenza is something that we have seen since antiquity. Starting from the 16th century, the pandemic influenza has struck the world at least 30 times in different shapes and forms and sizes. So you see, right now, we are living in a very globally interdependent world, you know, where people are traveling very fast, where you and me are connected and borders don't matter. People are living in proximity with animals, with pigs and birds. So, you know, there are all the ingredients available all across us for any pandemic to strike in the future. Also, India's role going forward will be very important in respect of the issue of WHO reforms. You see, there has been a lot of question raised about initial responses that the world had towards the pandemic and whether precious time was lost because of the way China was not forthcoming with transparent information. This is not the first time that, you know, the pandemic projections were made. You know, a number of times in the past, warnings have been issued. WHO and UN's own panels have, after the Ebola pandemic of 2014-16, said that you cannot rule out a COVID-19 type of pandemic in future, and yet there was no preparedness. So you see, it's all too well to say that the world is interconnected, but we are only as good as we are prepared to fight the next pandemic, which, you know, which is a reality. So India's role will be important in seeking WHO reforms as we go forward, because after all, somebody has to be accountable for all the death and destruction of 1 year.
Okay, definitely. That is the point there. And as Aditi was saying, you know, we are interconnected. That is in itself a boon and sometimes a bane as well. We will have to find ways to tackle such situations in future as well. Thank you so much, Aditi, Dr. Samiran Panda, as well as Dr. Arora, for sharing your views on a very, very important and significant aspect here. That is how India has played a leading role on the global stage in not only battling the pandemic, but also helping others. Other countries, national citizens of other countries with vaccine, with medical supplies, and now with a combined strategy which we are advocating to fight this pandemic and perhaps future troubles there as well. But before we go, let us also remind you about the COVID appropriate behavior, a 3-step simple process which all of us need to follow, starting with wearing our masks at all times, and also ensuring that we wash our hands regularly. Hand hygiene is really, really important, and follow physical distancing as well whenever you are in public space. These 3 steps will go a long way in safeguarding you as well as your near and dear ones. So keep watching Rajya Sabha Television. We'll come back again.